The Oversight Committee on State and Local Public Assistance Program will come to order. Will the clerk please call for the roll for today's attendance?
Chair Wolford.
Here.
Representatives Bruck.
Present.
Kara.
Here.
Cerniglu. Here. Menser. Here. Mr. Chair, you have 5 members present. You do have a quorum.
Thank you. Representative Menser moves to adopt the minutes on June 5th meeting. There being no objections, the motion prevails by unanimous consent. Today we'll be hearing a presentation from the Office of the Inspector General on the process of fraud referrals for DHHS assistance programs administered on bridge cards. Thank you for being here. I'm going to open with a quick statement and then we'll turn it over to you. So, thank you for being here today, Ms. Stacie Sampson and Mr. Doug Woodard. I appreciate you and your time. I hope you do not take some of the tough questions that we asked today personally, because I don't mean it to be that way. My concern from an oversight perspective as the chair of this committee is to address the fraud and the waste that we continue to see in Michigan's assistance programs. I consider your office to be a huge ally in this fight, but my problem from an oversight side is the structure. The Office of the Inspector General was created to be an independent and autonomous department who investigates fraud in Michigan's assistance programs. In fact, Michigan faces federal penalties and risks for losing grant funding if we do not investigate fraud and take it seriously in these programs like Medicaid, FIP, FAP, and other TANF-funded programs. So my concern, and I'm hoping that you'll address this today, is that despite your important role in investigating these programs and MDHHS administering these programs, the Inspector General himself is subject to an appointment by the MDHHS director. I hope that you can see my concern here, and I hope that we can trust that you do work independently, but we can no longer just take the department's word for it as this state. So this is why basically that we've asked you to be here today, and we'll probably be requesting data in a follow-up letter after this committee meeting. So again, thank you for being here. Look forward to hearing your presentation, and the floor is yours.
Thank you, Representative Wolford, for inviting us here today. I'm Stacie Sampson. I'm the Inspector General for Health and Human Services, and I have with me here today Douglas Woodard. He's the Director of the Bureau of Public Assistance Fraud. Again, thank you for inviting us here today. It's our pleasure to discuss our bridge card fraud investigations. But first, I'll start with a little history of how we became an office. Our office is a combination of 2 former OIGs. The Human Services OIG was established in 1972 as a criminal justice agency by the Social Welfare Act. And the Health Services OIG was created by executive order as an independent and autonomous entity within the former Department of Community Health. In 2015, the 2 OIGs were merged into one. Our mission is to assist the department in maintaining integrity and accountability in the administration of its health and human services programs, and to ensure appropriate and efficient use of available public resources. In addition to investigating cases of alleged fraud, waste, and abuse in the programs administered by the department, we make referrals for prosecution, review administrative policies, practices, and procedures, and make recommendations to improve program integrity and accountability. The 2 largest programs are Medicaid and the Food Assistance Program, or FAP. These programs are vital because they provide essential resources and support for individuals and communities, addressing social determinants of health, promoting well-being, and ensuring access to health care, social services, and other crucial needs. Last year, Medicaid had approximately 4 million enrolled beneficiaries, 237,000 enrolled providers, and a budget of almost $24 billion. There were almost 90 million Medicaid transactions. FAP had almost 2 million enrolled recipients, over 10,000 retailers, and a budget of $3.2 billion. There were almost 113 million FAP transactions, and at your request, we'll focus on FAP today. We accept allegations of potential fraud, waste, and abuse through an email, our website, and a toll-free hotline. OIG is also a member of an interagency fraud group that brings together 8 state agencies with authority to identify fraud in state government. By meeting quarterly, this group has improved communication and coordination between the various fraud oversight agencies in our state. The results of our investigations are presented to state and county prosecutors for consideration of prosecution. This list represents the relevant fraud statutes that may be utilized to prosecute fraud in public assistance programs. Last fiscal year, almost 200 felony warrants were authorized by county, state, and federal prosecutors. Last year, we developed a welfare pretrial diversion program with the AG's office. Enrollment of a defendant in the diversion program, as opposed to a traditional criminal prosecution, is determined by prosecutors on a case-by-case basis. This diversion program resolves cases of fraud in public assistance programs before necessitating criminal charges, prosecution, and potentially lengthy trials within the court system. This program increases accountability in public assistance programs while ensuring justice is administered efficiently. Since its inception, there have been 46 participants of the diversion program, and $74,000 has been returned to the state of Michigan. Next, we'll discuss the OIG's bridge card fraud detection activities. The landscape of public benefits fraud is a dynamic and ever-changing environment. Our staff consistently develop innovative and creative ways to identify, prevent, and combat fraud, waste, and abuse. We utilize a multitude of complex analysis, predictive analytics, and data mining solutions to uncover potential fraud. More than half of our investigations come from data analytics. Our investigators use those analytics information to focus their efforts of areas with the greatest risk of return, leading to recoveries and discouraging future abuse. Over the years, we've developed data sharing agreements with several other state agencies that allows us to use their data to identify potential fraud within our programs. I've listed 6 examples of FAP-related data scenarios that we utilize regularly. Unfortunately, we can't publish too many details about our data analytics tools because the fraudsters would change their behaviors to avoid detection. Recipient eligibility fraud is one of the types of fraud that our investigators focus on. Each program has its own set of eligibility rules, which are usually asset and/or income-based. Our investigators determine whether a recipient was truthful in their application. Last year, we performed almost 17,000 public assistance application investigations, resulting in $81 million in cost avoidance. The Public Assistance Reporting Information System, or PARIS, is a data matching service supplied by the U.S. government. It matches recipients of public assistance to check if they receive duplicate benefits in 2 or more states. We investigate PARIS matches to help identify improper payments and minimize fraud and abuse. For example, a PARIS investigation revealed that a recipient did not properly report receiving food assistance benefits in Michigan and Arizona. The recipient maintained a residence and employment outside of Michigan, exclusively using their Michigan benefits in Arizona for over 6 months. The recipient was ordered to pay over $7,000 in restitution and received a 10-year program disqualification. Last fiscal year, investigated PARIS matches resulted in almost $20 million in cost avoidance for Michigan. Through our front-end eligibility program, we partner with local office staff when an application has discrepancies and/or appears suspicious. The local office staff refers these suspicious applications to OIG, and our investigators confirm the accuracy of the income, asset, house, and household composition information disclosed by the applicant. Of the 17,000 application investigations that we performed last fiscal year, over 8,000 were these front-end eligibility investigations, resulting in over 4,000 of these suspicious applications to be denied, reduced, or withdrawn. As a result, we saved the department almost $32 million in public assistance benefits that may have otherwise been approved. Criminals fraudulently acquire stolen identities to obtain public assistance program benefits. For example, one individual used stolen identities to submit over 200 fraudulent applications and steal $33,000 in food stamp benefits. Another individual used stolen identities, including 2 deceased persons, to steal nearly $75,000 in food assistance benefits. This photo was taken during one of our investigations. Notice the fraudster included a sticker on each card with the relevant PIN number to keep them straight. Individuals sometimes sell or trade their benefits for cash or other items. They might sell the value of their bridge card to family and friends or advertise their benefit for sale on social media. While investigating unusual bridge card transactions, we discovered that the owner of a catering business purchased over $80,000 in food assistance benefits at a reduced rate to supply food for his business. The caterer was criminally charged, and the case is currently pending in court. This photo shows 2 individuals who purchased over $1,200 worth of bulk cooking oil for resale using a bridge card. In total, 625 units of oil, each weighing 35 pounds and totaling $20,000, were purchased with EBT cards from Illinois, California, and Michigan. Over the past few years, EBT card cloning fraud has affected thousands of Michigan bridge card holders. Thieves place a skimmer on top of a store's credit card reader to copy the bridge card information and PIN. They transfer the data to an unauthorized card and use it to steal the balance of that cardholder's bridge card. This photo is of a skimmer attached to the card reader of a store. This past year, we developed algorithms and data tools for early detection of compromised accounts and skimmer locations. Our EBT skimmer analysis uses geolocation data, recipient shopping patterns to identify potential placement of skimmers at retail stores. We partner with the USDA OIG when we identify these skimmers. These analytic activities have resulted in the detection and confiscation of 44 skimmers at Michigan retailers and have safeguarded over 76,000 bridge card accounts and more than $16 million in food stamp funds. The danger with EBT terminal cloning fraud is that these unauthorized locations are not inspected and do not have any oversight of their participation in the FAT program. These retail locations also engage in sales that are prohibited, for example, accepting a bridge card to purchase alcohol and tobacco. This photo represents a retailer in Michigan who was using these terminals in their store, which was not authorized to participate in FAP. They had stolen the terminal IDs of retailers in the state of New York and programmed these terminals to redeem FAP benefits here in Michigan, while transferring the proceeds from the fraudulent sales to their bank accounts. Criminals are gaining access to USDA Food and Nutrition Service terminal ID numbers from the dark web and other sources to replicate point-of-sale devices. This photo represents a restaurant in Michigan who was using a cloned terminal at their location. The restaurant was not authorized to participate in FAP, in the FAP Hot Foods program, to process FAP benefit transactions. The restaurant filed an application with FNS in 2021, but later withdrew the application. The location began illegally redeeming FAP benefits shortly after with a stolen FNS number. OIG defines mismatched transactions as FAP benefit transactions where a terminal at an unauthorized location is using the terminal ID of a Food and Nutrition Services authorized location to process the payment. Unpinning requires the recipient to reset their PIN before using their bridge card, as their old PIN was potentially compromised at the store when utilizing a cloned point-of-sale device. A search warrant was executed by local law enforcement and OIG at one of these unauthorized locations. And evidence of fraudulent FAP transactions and other financial crimes were located and seized, including several electronic card readers, as seen here. These card readers are believed to have processed hundreds of thousands of dollars in fraudulent EBT transactions. We recovered these cards, along with many others like it, from an unauthorized retail location that was completing illegitimate FAP benefit transactions. Last month, we sent a recommendation letter to the Secretary of the USDA. Through our investigations, we found that third-party processors do not have a method or ability to verify the FNS number that is used by merchant applicants for terminal setups, which allows the criminal groups to deceive these processors by providing false information about their businesses. The veil creates a lucrative method for these bad actors to easily conduct and conceal EBT fraud at the terminal level. The impressive results I've shared here today are made possible by the innovation and dedication of the employees of OIG. We have our group here, our leadership group, including those responsible for food stamp-related fraud investigations. Wave, everyone. For every dollar spent, OIG had an $11 positive impact on the department's program integrity. Thank you again for inviting me here today. The actions of OIG benefit all citizens by helping ensure that funds for these programs are available to the Michigan residents that truly need them. Taxpayers' money is spent on its intended purpose, and benefit programs are operating as expected. I am fortunate to lead such a dedicated team, and am proud of our ongoing work to improve integrity in the public assistance programs administered by the department. Thank you.
Thank you. I appreciate it. And thank you for the rest of your team being there. And we wave back to you. My wave's a little slower, though, because we had the Republican-Democrat softball game last night. And the only, if you see this spot right here, it's the only spot that doesn't hurt. So I want to say thank you so much for your presentation. Thank you for the work that all of you are doing. Obviously, it looks like you're busy. And we know from other committees that I sit on that this is an issue across or in different pods all around. So thank you for that. I do have a few questions for you. I'm going to focus on fraud identification, detection, and prevention. Another one will be criminal referral process and discretion, and then the last, accountability. On the first, both in your annual reports and in this presentation, you've used a couple of terms, and I'd like to clarify or have you clarify those. Could you explain the difference between fraud prevention and fraud detection?
You want to take that one, Dave?
Sure. We used the acronym FEE, Front-End Eligibility Investigations. That is what we partner with. That would be on the fraud prevention side. It's cost avoidance, cost savings. It's stopping the money before it goes out the door. Fraud detection is looking back at something that's already gone out the door and trying to retrieve it, which is a less effective model. So we really do try to stop some of the departments from issuing some of the funds that they're giving because they don't really have the true story or the true makeup of the case that they're working on. So that would be more on the fraud prevention piece. Fraud detection, again, would be the money's gone out the door. We are attempting to determine if fraud was committed, and if it is, we try to retrieve that money.
Okay, thank you. Do you believe that the bridge card application portal works in this fraud detection?
If you're talking about My Bridges, a lot of what's put in My Bridges is mandated by the federal government. We would like to see it, from the Inspector General's perspective, we'd like to see it tightened up a little bit. But I think that the constraint there is a lot of these federal programs are dictated by the feds, and they tell us what we can do and what we can't do, and how we can say it, how we can question it. And that seems to be the struggle that we have.
Okay. And having said that, I would like to hear from your office on some of those things that we could help you do as legislators to tighten that up, even if it's at the federal level, so that we can start working towards those. Representative Carl?
Thank you, Mr. Chair. You mentioned earlier that there were 17,000 investigations that led to $81 million in cost avoidance. How did you determine those 17,000? Was that a random sample?
No, we have our analytics team that produces a lot of the data. From historically, I've been in OIG for 30 years. We had paper applications when I started, and we had caseworkers that would send us the referrals, and we depended on caseworkers to make referrals to us. And we had caseworkers that thought every case that they came across was fraud, and we had other caseworkers that wouldn't know fraud if it, smacked them in the face. They didn't understand the concept. So we use data analytics, look at spending and patterns, location patterns, things of that nature, to determine if something is off. So a lot of those are generated by that, as well as a lot of the referrals that we get from the local office staff, because they have a keen idea of what's going on in their communities. And a lot of times when they're looking at something, they're going, this doesn't match. So they will send us a referral on those.
Okay.
So it's twofold.
Yeah, thank you. And of the 17,000 that you investigated, do you feel that that was a fully exhaustive list, or do you believe that there would be substantially more, that if you looked further, you'd find even more cases of prevention that could be done?
We could definitely do more.
Okay.
Yes, absolutely.
Thank you.
Representative Bruck?
Thank you, sir, Chair. I have a question regarding the Paris. How long have you been using that system?
I'm going to,
I mean, I don't need,
roughly 10
exact-
years.
A few years?
Yeah, quite a few years.
And do you find cooperation with every state?
Not always. We have had, Paris was mandated by the federal government only a couple years ago. So, and we have challenges with some of the states that come in like an August match, but they're supposed to include all their population on Medicaid and food assistance. We generally look at it as, and then when we take that data, we have to actually scrub it and make sure that somebody hasn't physically moved from their state to our state. So there's a lot of massaging of the data that we get from Paris in order to get a sample or a size that we can actually go out and look at. And over the years, we don't like sending our investigators out to search for things that that really don't produce any fruit. So what we do is we try to target the areas that really do show a sample size that works. And as your question was, there are states that we've had struggles with getting data from when we request them, and we work with, try to work with them, each state individually, to say, hey, could you please get somebody that can give us this information?
Because is it a federal repository of information, or is it each state is sending to the other state, per se?
Each state's sending it to the federal repository.
Okay. It's just some states are not, they do it different times, or maybe not even doing it, or not adequately enough.
Or their data is lacking information. There's a whole laundry list of things that the feds have required. Some of that data doesn't match up with some of our data.
But if that was a better system, it would certainly help you folks out.
Absolutely.
Okay. And another question on that. Prior to using Paris, you said the benefits and how much fraud it's identified. Has it helped, I guess, or how much value has it given us? And obviously it's made your job easier, but how did you have to do that before?
We still did geolocation of where bridge cards were spent. So if somebody applied for benefits in Michigan and spent 18 months using their benefits outside of Michigan, we would generally look at that as a problem. So, hey, are you really in Michigan? Michigan and all the other states are required to do matches on unemployment, on wages, on other factors. And our problem with the feds, and we've discussed this with them several times, is if Michigan is housing this person on their rolls, they've got to run their internal matches. Well, if the person lives in Hawaii, we run a match, we're not picking up their employment in Hawaii. You understand? And it's part of our struggle is trying to get them to police their benefit program. It's 100% federally funded, all the food assistance. So we're trying to get them to help us. And that's been one of our pieces. And I'm not just speaking on behalf of Michigan. We have, I've met leadership all across the country, and they're all on the same page. Why do we allow this?
Well, we appreciate your investigative endeavors and trying to protect our dollars, and just as we, ideas that could help photos on the bridge cars. Is that something you guys have thought of doing?
This isn't the first time photos has come up, and we have it came up 6 or 8 years ago, and the problem is that I'll ask you, when was the last time you showed ID when you purchased something? And myself included, I like self-checkout. So, but even when I go, and I've had my daughter say, "Hey, just use my credit card." I'm like, "I'm not doing that. I'm not. I can pay. We can pay for this." But nobody is checking as long as that goes through. That transaction goes through at a terminal. Nobody's checking. So rather than if you guys were looking at a thing that could really help us. We've got magnetic strips on these cards, and the feds just authorized us late last year to go to chip card technology. And this was October is when we got the notice. We really we need the money to replace our swipe cards to bridge card technology. And that's a $6 to $8 million Michigan cost. The feds pay 50% of that. That would really, really help us. More so than the pictures on the cards. The other thing is that by Food and Nutrition Service, in their rules, I can shop for anybody. You can shop for anybody, and it's set up for people that aren't able to go out and buy their own groceries. And it's a great principle, but it doesn't really match credit card laws. You can't really do that in the credit card world. But because of that rule, if a police officer stops somebody and they say, "Hey, this face doesn't match your person." Well, first of all, they're going to know the face because they got facial recognition through the Secretary of State. They're going to see the ID. Those people, when they match, when they had multiple cards, they're totally okay for having those cards unless they're stolen or sold. And we get referrals from that from local police departments, and we do look into them.
I appreciate that
picture would
insight.
help.
Thank you very much.
Yep.
Thank you very much, sir,
Yep.
ma'am.
Do you think that authorized users on bridge cards increase the chance of fraud?
Yes, and again, that's a federal program, and that's what they've deemed to do that. But yeah, anything that's loose or allows for that, and again, authorized reps are not ID'd. You could put anybody's name on an authorized rep card.
Do you have some for instances of things that you've seen on names that people have used? I mean, they could put anything, right?
They could
Wonder
put
Woman?
They could put their pet's name on that
Yeah,
card.
right.
But again, people don't really do that very often. I'm just saying that, in the world of fraud and waste and abuse, tightening down an authorized rep would be great. But it doesn't stop me, even with an authorized rep card, it doesn't stop you from giving me your card if you had one, and me saying you're authorized to use your card with your name on it and let me go to the store and buy groceries for you. There's
you're-
nothing wrong with that. It's totally legal.
Right. Well, your office should be happy to know that I put forth a bill that requires a picture of the user and the authorized user on there, and whether they check or not, it's going to require both of those people to come in and get an updated photo and get their benefits card updated. So having said that, knowing that it will cause people to come in, get a picture taken, do you think that there'll be a lot of criminals that are stealing these benefits that would show up to get their picture on their card?
It would certainly deter a criminal enterprise who apply for benefits online from coming in, for sure, yes.
Great, thank you for that. Also, and I know the answer for that, but I want it to be reiterated for those that are listening or see it after. We talk about other states as it relates to our Michigan bridge cards that we have, the bridge card. So are you allowed to use those in other states?
Yes,
Okay.
that's federally mandated.
So I would imagine if you're on assistance because you need help, maybe we've opened this up in case you're on vacation and you need to shop for food on the, I mean, like what would, in your opinion, why would we allow this, especially, I have a hard enough time traveling sometimes, so you get where I'm going with this. Could you give me your input on that?
Yeah, I'll just tell you that the federal program, it's a food assistance program, and there are cases where people have loved ones in other states, that they're watching them, that they're caring for them. There are situations where it is acceptable for them to use their card in other states. And that's why we monitor the activity to determine how long is long. But we have, again, the feds have told us, as long as somebody plans on returning to that state, that home state, and it's in their federal regs, they are allowed to continue being on Michigan public assistance. So you've got extremes on both sides. You've got people that take advantage of that, no doubt. But you also have people that do need that. And there's reasons for people needing public assistance, and especially on border states, Toledo, people that live in southern Monroe County, they'll shop in Toledo. It's a lot easier and quicker for them to shop. So there's a lot of different reasons for that. It's not just people vacationing in Florida, and we have snowbirds too, who are on public assistance, and half the time they might be spending it in Florida. There's so many things, they decided to cast an open net and say, this is okay.
Okay, thank you. And are there added benefits? There's obviously added benefits outside of a bridge card, like some states have higher payouts, right? Depending on where you're at with other supplemental programs. Is that correct?
Yeah, states determine some of the eligibility and the amounts of money, but it's all on a federal guideline. So yeah, there's different states that have different parameters.
Okay, so are there, and you don't have to answer this now, you could get it back to me, but if there's other states that you see that the parameters are a little tighter or less, I'd like to know that because I'd like to look at following some of that. And it's ironic because I had not thought of this and this happening until we were preparing for this meeting. When I was in the Marine Corps as a young Marine, making $900 a month with my wife, who was a Marine, and our first dependent, Jenna, as a baby, I remember going and working at night after I was serving in the Marine Corps, and then on the weekends doing sign work, and then my wife, a Marine, working at Target at night. And we lived in an apartment off base, and I remember meeting this young couple around our same age, and he had introduced himself because they lived in the unit next to us, and he said they had just moved from Hawaii and that they had moved to California because the benefits were better. And I didn't even understand what he was talking about then until I started going over all of this. So that was the reason for my questioning is, you know, if we can tighten things or make those perimeters a little bit different to deter that would be great. So with that said, Representative Menser.
Thank you, Chair. And if it's all right, I have two questions. So what I'd like to know, you talked a little bit about the going from the magnetic strip to the chip card technology, and stated that, you know, you would need money to make that change. How much money are we, just a guesstimate, how much money are we talking?
The department has already got a bid through the current contractor, and they've come up with a price depending on how many cards at the time, and the department's trying to clean up some of the cards so they're not replacing cards with low amounts that have been sitting around for over a year that nobody spent anything on them. So because of the cost per card. So they said it's going to be somewhere total of 14 to 16 million, of which the department would only have to pay half. They would have to pay half of that. So we're looking at between $7 and $8 million.
So you would need between $7 and $8 million in a appropriation from this House.
Absolutely.
Thank you. And my second question is, just considering Michigan, are there areas in Michigan where the fraud for FAP is wider? You know, is the fraud more prevalent in, you know, Detroit or Pontiac or Hillsdale or, you know, Kalamazoo? Is there a geographic area that you know that has a propensity to have more fraud cases per SNAP, per FAP user?
It's a great question, because when I started this job years ago, we were doing trafficking investigations solely in Detroit, and we've had complaints of trafficking in Gaylord, and the UP, all over the state. So it used to be more of I would say, an urban issue, but it is, if you follow where people are located, especially people who are on public assistance, you'll find that the fraud pretty much goes across the board now. So I would say, to your question, yes, Southeast Michigan would be a hot spot because half our population resides there. So geographically speaking, you know, we have pockets in Muskegon, Grand Rapids, Kalamazoo, Benton Harbor, Flint, Saginaw, all the major cities have more fraud because there's more people on public assistance.
Okay, thank you. And one more, if it's all right, Chair. I noticed on your website that you are looking for fraud investigators. You have a beautiful team behind you. Do you feel like you're fully staffed to make sure that this fraud, is captured as best as you can?
We use the resources that we have, and we could always use more. Truthfully, it's we can't look at every single thing. We have to screen referrals that come in based on priority, but we could always do more. We are constantly screening and looking at and adjusting, but yes, we could always use more help. We are working on fully staffing. We've got a couple of vacancies left.
Thank you, and thank you for the work that you and your team do.
With an answer like that, you may have a career in politics.
Too many skeletons.
So we talk about $7 to $8 million in a payout to stop hundreds of millions of dollars of fraud at a minimum. What is the holdup? Why isn't this being done as it relates to the chip?
Okay, so the federal government, 2015, October 1, 2015, and you guys all remember when your swipe cards became chip cards. And on that date, or in that time period, the stores took over the liability if they swiped rather than use the chip processor. Food Nutrition Service, USDA, made a conscious decision back at that time that they were going to wait a while because we had plenty of smaller store owners in some of these areas where there's not a lot of food delivery. They were going to wait to put that technology in because they didn't want to burden some of those small store owners. That was one of the logical reasons they had. But we're now 10 years later, and the feds and many of us in the investigative community have asked for those chip cards. because the skimmers can be easily purchased for a little over $100 to skim your information off a card. That's how easy it is for them to get the technology to clone a device and create a new card with all your information, and they'll have your PIN number on it. So you asked why the feds have not allowed that since until October of last year. They announced that they were allowing states. Only 2 states were piloting it before that, California and Oklahoma. California went live January this year with chip cards, and Oklahoma's set to go live in July or in June, summer of 2025. So they're the only 2 states that have been authorized to do that. So again, this is a federal problem.
And while it's a federal problem, did you say that they'll pay for a portion of these?
Yeah, 50%.
50%?
Yep.
Okay. So, wonderful. Thank you. Representative Cerniglu?
Thank you. So I just wanted to hear a little bit more about some of the, I guess, operations that are going on with stolen terminals and, I guess, converting the benefits, to other items. And what does that look like when you investigate and identify, someone who's done this? And are there penalties? And who's actually prosecuting that? And what types of, items or like just more information
Sure.
on that?
A lot of it's cash, 50 cents on the dollar. So if I'm trafficking my bridge card, and whether I'm going on social media, I want to get some cash for my food assistance, I can generally get $50.
Oh, actually, not to interrupt you, but I meant like where they're doing the closed point of sale terminals, and so not like individuals that are trying to do it, but when their information's being stolen.
Representative Cerniglu, I'd like you to finish what you were talking about on the 50 cents on the dollar, and then answer her question, please.
Oh, sure.
Okay,
Sorry, I
so-
didn't
Oh, no,
correctly
no,
state my
yeah,
question.
No, it's okay, yeah.
So the 50 cents on the dollar has been kind of the industry norm. So we talk about alcohol, cigarettes, and other tobacco and other items, but really it's converted to cash. And the bigger the operation, the more likely we're going to go prosecution on those. And the penalties that you talked about for that are 1 year for a first-time offense. If the trafficking is a certain amount, it can be a lifetime disqualification, and there are penalties that kick people off the program. So the organized criminals, though, are probably facing more like jail time because they've done this on several occasions, and we have a larger amount of money.
And the USDA OIG prosecutes at the federal level if it's a retailer.
Yeah, retailers, yes, and yeah, USDA OIG is in charge of the retailers. We're in charge of the beneficiaries as far as the recipients. We look at those, so we're in partnership with them. They look at the stores.
Okay, yeah, because I was kind of curious about like the stores that were doing it as well, and like what were they buying that was like a prohibited item?
Stores don't necessarily buy prohibited items because.
No, I mean, what was well, it says here in exchange for prohibited items on the EBT terminal cloning slide.
That would
It says,
probably,
So that would be anything other than food.
okay, so there's nothing specific like that okay,
Right.
that's fine, thanks.
So would you be able to get, I don't know, ribeye and alcohol?
ribeye, yes,
Okay,
no alcohol.
no alcohol, okay, thank you. Representative Carr?
Thank you, Mr. Chair. Given that your Office of the Inspector General works within the Department of Health and Human Services, how much does Director Hertel have involvement in the process when you seek to identify fraud?
None whatsoever. I'm allowed to be completely independent in identifying and investigating allegations of fraud, waste, and abuse.
Okay. And so you are independent, but do you ever collaborate with the director?
We collaborate with the program staff more so because they understand the programs. They are the ones who deal with the beneficiaries and the recipients in the application process. So we collaborate more with them because they're able to provide us the information that we need to do our job.
Okay. And does the governor collaborate in the process from what you see at all?
Not that I've seen.
Okay. Thank you.
I could add, during the last administration, the governor did ask the Inspector General to look into Flint water, and we were investigating the department director in that situation. That was one of the groups that we were investigating. So we have, but very rarely will the governor's office. I can't recall a time before that.
Okay. Thank you.
Representative Bruck?
Thank you, Mr. Chair. Question on fraud, I'm still thinking about this, Paris, but, so what is the biggest actor? Obviously, you have grandchildren or family members that are using or fraudulently using, those are probably onesies, twosies, but as far as these big actors, who is the organization, or who are these actors that are getting the most, out of our system fraudulently?
Probably in the identity theft arena, where they're able to submit applications and turn on cases. In some cases, the Social Security Administration stopped geolocating Social Security cards several years ago, but we did have the ability to see if you had a 3.8 or a 3.6 starting on your social number. We know you're probably born in Michigan. And but for your kids and grandkids, those numbers are all over the map now. So when you look at that, they're using social numbers, these bad actors, from people outside the state of Michigan. They're using numbers from people that they know and identities of people that know that we're not going to bump up and say, hey, you're already on public assistance in Michigan. So the criminal entities are purchasing through the dark web and other areas. An insider at a company, they're purchasing IDs, names, social security numbers, and they're able to apply for benefits on them.
So that's the largest
Yes.
amount of money being given out fraudulently, more so even than, these, I know on the one page you had the picture, the pile of cards. Those are kind of small peanuts compared to these other folks then.
Well, when we go with the state police to do our search warrants, we find more than just a small pile of cards. We'll find lots of information, the data, logbooks of information showing when the caseworker calls, they already have the information that they know for each one. So it's pretty sophisticated.
And considering an ounce of prevention is worth a pound of cure, on all the analytics that you do, are you folks implementing AI in that currently? Is that on the docket in the future?
We have been looking into AI. We are working on that. We've had,
Yeah, we're working to acquire something right now.
You're welcome to come up, sir, to the microphone. Thank you.
This is Casey Barton. He's the manager of our data analytics section.
The bean counter.
We are leveraging an FNS fraud framework grant right now to acquire some machine learning advanced analytics software that we will be using to try and better identify the best cases of trafficking and identity theft.
Good to hear. Thank you for that. Yeah, I'm always interested, on how can we better avoid the issue in the first place, which is obviously your folks' job. So appreciate your work. Thank you.
Question, what does the Inspector General feel is an appropriate case, or what is the threshold that you use? And I guess a statement after that question is, wouldn't a crime being committed not be sufficient?
So what's our threshold?
our thresholds, by statute, it's $500, or if it's a repeat offender, or if it's a public figure, an employee, somebody, our own employees, we will look at things at a very small amount if it's a repeat offender. But generally, the statute's $500. There are no prosecutors that are going to charge a $500 case nowadays with the landscape of everything else they have to deal with. So, you know, it is one of those deals where we use an administrative process on a lot of our cases. First-time offenders, somebody who's made a mistake, and you know, we hold them accountable. They get a 12-month disqualification in the FAT program if we determined and we're successful in getting our case heard. We offer voluntary repayment and disqualification agreements. Many people own up to it. They'll sign those. It keeps things out of the court.
Okay, thank you. Representative Cara?
Thank you, Mr. Chair. How many people did you say are on a food assistance program in Michigan?
2 million, yes, that's 2 million
2 million?
last year.
And how much is that in total funding for that?
3.2 billion.
And what percentage, if you had to put a ballpark, of the total funding would you speculate is fraud?
It's difficult to come up with that percentage because we only know about what we find, and we know that we haven't run out of potential fraud cases yet.
And what percentage of the fraud investigation that you've done has turned up to identify fraud?
Well, we try to prioritize cases that are more likely to have an outcome of fraud. That way we're not wasting our investigators' time on dead ends. So what would you say our percentage of fraud found is?
It ranges, but generally it's around 50%. So if we get a referral on something that we look at, and we take a hard look at that case, 50% of them turn out to be a fraud. But that's a tight analytic set. Now, it's not across the board, 50% of the program's committing fraud.
Sure, but you've investigated about 17,000, about 50% of them turn out to be fraud. If you were to do more, the number might go down, but there's a lot more fraud out there if you were to look for it. It's just the percentage would decrease as you start to look further. Is that fair to say?
No, let's clarify the 17,000. A lot of those are front-end eligibility investigations. They're looking at things before they go out the door. There's not necessarily a fraud component in there. It's really identifying error-prone type cases and taking action on them. It doesn't necessarily meet to a fraud standard. The fraud cases that we do are probably representative more like a 2,000 cases a year.
Okay.
And I'll just say 2,000 to 4,000, and half of those are actual fraud. And
Okay.
that's a full fraud investigation.
Okay, thank you.
Yep.
Great. Well, thank you so much. I appreciate it. I want to close as I said at the start of this, and I want to reiterate it. My issue is not with either of you. You're both doing a great job. Seems like your department's doing a great job. In fact, I feel that both of you, I can sense that you want to do what's right, and you want to do what the inspector would want you to do. But independently, as you investigate and you're doing what's right, it still seems a little bit to me that you'd be stuck doing whatever the DHHS allows you to investigate or flags for you. Not necessarily looking for an answer on that from you. But my closing question would be, what can we do as a legislature to help you do your job better? Because that's important for us. That's in part of why we have these oversight committees, looking for waste, fraud, and abuse, but also looking at how can we improve the systems that we have in place and make them better to make your job easier. And I say that because in COVID, we've seen welfare fraud, medical fraud, and fraud in basically all of the assistance programs rise to a new level that we've never seen. Fraudsters are smart, as we've seen today in your presentation, and they're hard to catch. So what can we give you to better arm your office and the Inspector General at this point in time?
Well, we would never turn down more bodies, but we did talk about the chip card technology. That's really first and foremost, the need for the department as well as our agency. It's not going to stop benefits from being stolen, but it'll stop the constituents out there. Every one of you guys has constituents, and they're the ones that are getting their bridge cards stolen. And the Fed stopped backing those stolen benefits in December of last year. They realized it was their problem. They said, hey, we're going to have to, and Congress passed 3 different appropriations to help supplement the lost benefits by the recipients. Now, it's on the state. And, you know, if you really want to help make us change, you would get those, help us get that chip card technology. It's not going to prevent thieves from trying to spoof somebody on an email or phone. Credit card fraud's on the rise. It's up like 12% this last year. So, and those are chip cards. But people get, especially seniors, vulnerable adults, they get scammed. But you'd think a point-of-sale device shouldn't be happening nowadays. You shouldn't have skimmers. And the skimmers aren't just in the smaller stores. They're in Walmart. Walmart's got their technology's a little bit behind, and they've got devices there that they easily put a skimmer on, and you wouldn't know, honestly, that you're putting your card into a skimmer. It's that advanced, so that would be the big ask on my end.
Yeah, I agree. Help the department help us.
Awesome. Anyone have any questions? No? Okay. Thank you again for being here today. I appreciate that. Appreciate both of you and your team. There being no further business, this meeting is adjourned.